Welcome back. Well, how many times should you floss? In a survey, most Americans said twice a week. I don't think that's very much. Okay. Our next guest says that's not nearly enough, and I would probably agree.
For sure. She's also here to share some surprising secrets about foods that are bad for your teeth and foods that actually help. Debbie Selfer is a dental assistant from Dental Associates Milwaukee location. It's one of just 10 locations all throughout the state that you have. Nice to have you this morning.
Thank you for having me.
Thank you so much for being here. Everybody knows that they should brush their teeth when they get up in the morning. But do you feel like there's certain things that people tend to do wrong often as it relates to their teeth and their gum health?
Yes, most people don't realize you should be brushing your teeth twice a day for 2 minutes. A lot of people brush their teeth, say, for 30 seconds, and then they stop. You're not actually cleaning your teeth correctly then. Another thing is you should be using a soft nylon toothbrush, not hard or medium. Make sure it's soft. Circular motions when you brush your teeth.
Oh, you got a big mouth as an example here.
Circular motions along the gum and along the
brush,
teeth.
because I think people think if they do it hard and fast and the bristles are hard, that's better.
No, because you can actually do damage to the teeth and to the gum tissue.
Okay.
Another thing also is you should be changing your toothbrush every 3 months. And what people don't realize also is when you are sick, you should get rid of the toothbrush.
Okay.
Oh, that's a good point, because a lot of those germs can live on there.
Correct.
So if you're doing the brushing right, you're brushing twice a day, morning and night. How about the flossing?
Flossing you should do at least once a day. And when you take the floss, you want to take it between your teeth and gently between the teeth. You want to remove any bacteria or plaque. If you don't remove that, you can get sticky residue, which can actually give you sensitivity to your gums, cavities, and things like that.
I have a question about flossing that I've never known the answer to. Do you floss before you brush or after you brush? Because people always tell me something different.
Yeah.
Actually, I prefer the floss first and then brush because you're getting the teeth, food out of your teeth.
I do that too.
That's what seems to make sense, but I've had other people tell me otherwise. So does it matter, or is it just that you actually floss?
You should floss before.
Okay, good.
Okay, what about kids and flossing? Because I think adults, it tends to be a more difficult task for kids.
That is correct. What you should do is actually, same thing, twice a day, brush their teeth and floss. You should actually do it for them until they're 4 or 5 years old. After that, when they're 7 or 8, just observe them with brushing.
And you don't use fluoride toothpaste in the beginning.
No.
That's something you work in as they get a little bit older, right?
There's a non-fluoride toothpaste or a training toothpaste that you can use. And the kids should also come in every 6 months for their checkup, x-rays, and we at each dental facility we do have a pediatric clinic, a pediatric doctor, within the clinic, so they can work with you. So
nice.
Many people have trouble when they floss that their gums bleed, and that either can stop them from flossing enough, or they just worry that there's something wrong. Is that normal, and why does it happen?
Inadequate brushing, flossing. What happens, you can get gingivitis. Same thing like when you get a cut, it's the same thing, you have to take care of it. Hygienists, you need to come in and get your teeth clean where they will remove the plaque. Usually you have a harder plaque. If the gums still bleed, we do have specialists, again, within the clinic that we can have you see.
You brought a visual for us. We're going to leave them sitting on the counter here, but I just want to go through how much sugar is in some of the foods that we drink in particular that are a problem for our teeth. And what you have are little bottles here, starting with the blue one. And this is an example of how many teaspoons of sugar are in an energy drink, which is 1.25 teaspoons, so 1 1/4 teaspoons of sugar. But look at the Kool-Aid next to it. That has a lot of sugar too, but I think what is shocking is the soda. A can of soda pop has 8.5 teaspoons of sugar. And low-fat milk has 3.5 teaspoons of sugar?
That's correct.
Wow, that's why babies aren't supposed to be left with milk in their bottles at night. And then the juice, maybe not as surprising. How many teaspoons is that? Can you see that?
9.5.
9.5. Yeah, so that's stuff when you drink it, that's sugar that stays on your teeth, right?
That is correct. That's why if you can't brush right after, if you have a good fluoride mouthwash, rinse with water, that'll help with it.
Okay.
All right. What about someone who has sensitive teeth? Are there ways that you can help with that?
That's a good question, actually. A lot of your foods have acid in it. Things like soda, diet soda, vinegar, wine, salad dressing. And what can happen is you get that on your teeth, okay? And that's not good because it can eat away at your teeth. A lot of people don't know after you brush your teeth, you shouldn't brush it for 30 minutes. You shouldn't brush your teeth for 30 minutes due to the acid in it.
See, I think that's such a fascinating point. A lot of people want to brush their teeth right after they're eaten. What you're saying is wait at least 30 minutes to brush your teeth. And if you're not able to brush your teeth, then you said use a fluoride mouthwash. But there's a food that you can eat after you know, have your meal that's actually good, right?
Cheese.
Cheese. Can you believe that? There you go. Permission to eat cheese.
Why is it good?
It's just to tell you the truth, I'm not sure what it is in the cheese that actually helps the teeth. So,
but it does help your teeth.
Correct.
It's unbelievable. Or sugarless gum,
Correct.
right? Because it stimulates the saliva flow.
That
Okay,
is correct.
That's good information about your teeth. I love that. And if you would like to find a Dental Associates location close to you, you're going to be able to find one because there are 5 locations just right here in Southeast Wisconsin and then another 5 locations throughout the state. The website is dentalassociates.com. It was a pleasure to have you,
Thanks,
Debbie.
Thank you for having me.
Thank you so much.